Welcome to this quick explainer. So today we are completely tearing down everything you thought you knew about clinic no-shows. Seriously, when I first looked at this massive scoping review published in the SAIMSARA Digital Health Journal, wow, the sheer scale of it just totally shifted my perspective. We aren't just looking at a tiny sample size here. This review maps out evidence from over 456 original studies. That encompasses nearly 24 million sample observations, literally 24 million. So what does a data set of that size actually tell us about why our waiting rooms keep ending up empty? Let's get right into it.
It's the million-dollar question, right? Why do patients really miss appointments? Well, the tired, exhausted assumption across the medical field is almost always that patients just simply forget. The thinking goes that they didn't care enough, they forgot to write it down on their calendar, or they just couldn't be bothered to show up. But when you dive into the actual data, that assumption completely falls apart. It turns out, patient non-attendance is rarely a memory problem. It is a friction problem.
Okay, let's dive into this, because the contrast here is pretty wild. What do clinics usually do? They try to fight no-shows by threatening financial penalties or blasting out generic, automated text nudges. But the review found that these financial penalties have practically null effects. Honestly, when baseline no-show rates are already low, they aren't even cost-effective. And those generic text messages? Some studies showed conversion rates of less than 1%. No way, right? We are literally using a punitive, robotic approach to try and solve what is a deeply human problem.
The core conclusion the researchers drew from those millions of data points is absolutely fascinating. Missed appointments heavily cluster around systemic issues. We're talking neighborhood deprivation, a lack of public insurance, crazy work schedules, and just plain old transportation barriers. Look, if a patient doesn't have a car or they absolutely cannot get time off work, sending them a generic text message or slapping them with a $50 fine isn't going to magically teleport them to your clinic. The real culprit here is practical logistical friction. And this brilliantly illustrates what happens when you actually treat that friction. I was completely blown away by this number, 2.80. That is a massive odds ratio. In one specific study focusing on tuberculosis clinic attendance, they swapped out the standard generic care and simply used a human phone reminder in the patient's preferred language, not an automated robot, an actual human being having a real conversation. That single accountable point of contact resulted in a 2.80 odds ratio for attendance. It completely transformed a compliance rate, simply because a human can actually problem-solve barriers with the patient right there on the spot.
But hey, you don't always need to hire a huge call center to fix this. Just look at this jaw-dropping jump in follow-up attendance, going from 43.9% all the way up to 62.9%. How did they pull that off? By simply using a pre-discharge scheduler. By booking the patient's next appointment before they even walked out the hospital doors, they totally removed the friction of the patient having to navigate some confusing phone tree later on. It's proactive, barrier-matched scheduling at its finest.
So the SAIMSARA review gives us this incredibly clear roadmap of the barrier-matched systems that actually get the job done. We absolutely have to stop treating no-shows as a symptom of bad memory and start treating them as a symptom of bad systems. The solutions? They include language-concordant human phone calls, actually integrating patient navigators and social workers into clinics, using those pre-discharge scheduling tactics, and setting up fixed, immediate rebooking pathways. These are real, evidence-based, human-driven solutions that actively crush logistical friction.
I want to leave you with this final, provocative thought. Are you treating the symptom or the barrier? If your clinic is still relying on generic texts and empty threats of fines, you are honestly just wasting valuable capacity. I highly urge every single healthcare leader watching this explainer to go dive into the full SAIMSARA review. The data is crystal clear, the solutions are right there, and it is definitely time to start building systems that actually work for our patients. Thanks for hanging out with me today to unpack this, and I'll catch you next time.